Hello, I'm Dr. A and classmates. My name is Delmi Pacheco, and I'm going to present my patient with chest pain times 2 days. That was his shift of complaint. Mr. RT, he's a 60-year-old Hispanic male presented to the clinic complaining of chest pain that radiates to the left shoulder blade. This one started 2 days ago while he was mowing the lawn. Um, Pain lasted about a few seconds. It was sharp pain about 5/10. I'm sorry, 8/10, and went away. The next day, the pain continued about 3 times during the day, but still the patient didn't want to go to the clinic. The following day, patient complaining of 6/10 sharp pain that came suddenly, denies any taking any pain medication, and and the wife told him that he needed to go to the clinic. According to patient, he didn't have any other symptoms, only the pain in the mid chest that radiates to the left shoulder. Um, Denies any shortness of breath or any difficulty breathing. According to patient, he has history of hypertension, diabetes, cholesterolemia, and BPH. He is currently taking metformin 500 milligrams PO/BIT, lisinopril 10 milligrams PO daily, hydrochlorothiazide 25 milligrams PO daily, Flomax 0.4 milligrams PO daily, atorvastatin 40 milligrams PO at HS, vitamin C 500 milligrams PO daily, and aspirin 81 milligrams also daily. Um, Patient didn't want to come to the clinic, but um, wife told him to come. Um, he denies taking any medications to relieve the pain, and he said he went away and with nothing, just like that, and came back again. He's allergic to penicillin, and his immunization is up to date. Family history: mom has diabetes, hypertension, cholesterolemia, and she passed away at 72 of a heart attack. Dad had diabetes, hypertension, GERD, and he died at 70 from stroke. He has a sister, she's living, she also has hypertension, diabetes, and she is 65 years old. Brother with hypertension and cholesterol, 63, he's alive. Um, from the maternal side, grandmother, she died at 70, he doesn't know why. Grandfather died at 69 from a heart attack. From paternal side, grandfather died at 80 of with COPD, respiratory failure, and grandmother died at 72 from kidney failure. Social history: patient is married. He has 4 kids. According to patient, he doesn't smoke, drink, or do any illicit drugs. Live with his wife and is sexually active in a monogamous relationship. Patient walks daily about half a mile, and during the ROS review system, patient denies any fever, but he stay feeling a little tired. Um, Denies any changes in weight, denies any issues with his head, any lumps or bumps. Ears, eyes, and nose with no problem, no drainage, no bleeding or redness. Reports using reading glasses. Cardiac wise, reports chest pain mostly that when he's doing activity that travels to the left shoulder blade. No edema, no shortness of breath, no palpitations, and no difficulty breathing. Respiratory: no shortness of breath, no difficulty breathing. GI, no issues, no diarrhea, no constipations or changes of bowel movement, no nausea or vomiting. GU report intermittent voiding due to his BPH. Sometimes he has a little trouble starting urination, but it's better with the Flomax. Denies pain or burning sensation during urination. Musculoskeletal denies any bone pain or swelling or stiffness to the joint. Skin, no rashes, bumps, or lumps, reports dry skin. Neurological patient denies any syncope, tremors, or slurred speech, headache, or forgetfulness. Psychiatry denies any sleep disturbances, anxiety, or depression. Endocrine's patient reports having diabetes type 2, denies any heat or cold intolerance, report feeling tired since he started with the chest pain. Allergies, reports allergies to penicillin. He gets this general rash. No environmental or food allergies. Immunological denies any easy bruising or getting sick often. Lymph nodes are they're not swollen or tender. According to patient, no bumps that are tender or swollen. Objective assessment, vital signs, blood pressure is 135/82, heart rate is 92, respiratory rate is 18, temperature 98.8 Fahrenheit, saturation of 96% on room air. Patient is complaining of pain of 6 out of 10. It's radiating to the left shoulder blade. His height is 5'7", weight 168 pounds, BMI of 26.3. So it's on the overweight side. Um, General, he presents his well-groomed, calm, and a febrile. No issue with the eyes. The perla, cranial nerve 3, 4, and 6 are intact. No bumps, no lumps noted to the head, ears, no drainage, nose, no issues noted, no drainage. His mucosa is pink and moist, as well with the oral mucosa. Neck is supple, no swollen lymph nodes noted. Check anterior and posterior cervical, sub submental and supraclavicular areas with no swollen or tender lymph nodes. Respiratory, no shortness of breath, no difficulty breathing was noted. Cardiac wise, S1, S2 is present. I didn't hear any murmurs or any rubs or extra sounds. GI denies diarrhea, vomiting, or nausea or constipation. Abdominal is soft, non-tender with bowel signs present to four quadrants. Normal active. GU report having BPH and he's on Flomax. No other issues. No burning or pain sensations during urination. Skin, I didn't see any rashes, bumps, or lumps. Skin is a little dry. Um, Musculoskeletal, no joint problems, no stiffness, no um, pain or problems with RON. Steady gait, lymphatic, no swelling lymph nodes, like I mentioned before. Hematology, I didn't see any bruising or petechia to the skin. Patient denies any bleeding, rectal or nose bleeding. Neurological, alert oriented, responding properly to questions. Both of them, the wife and the husband, are reliable historians. No dizziness, no speech issues. Psychiatry patient has no signs and symptoms of anxiety or depression, and he's in appropriate mood. So for my differentials of chest pain, I got it could be in my sleep angina and pericarditis. Chest pain can patient can have a chest pain, but it can be many things. We don't know until we check and we have them do an EKG first. So in mind for me would be one of the first one. It can be a heart attack. It can be caused by incomplete complete block of blood flow to a portion of the myocardium. It can be silent or it can cause pains or like in this case can cause chest pains that travels to the back arm. Um, it might cause indigestion also. Some patients might feel nauseous, like they want to throw up. In this case, We did an EKG that show ST elevation, so we call 911. But other differential diagnosis can be unstable angina, chest pain that is sudden and often gets worse over a short period of time. Usually with unstable angina lasting 15 to 20 minutes and usually occurs while resting. The patient complained with chest pain, that it was sharp, um, but it didn't last that long. It lasts few seconds according to patient, but he couldn't tell me exactly the number of seconds. But it went away and it came back throughout the day, the second day. Another differential diagnosis of chest pain can be pericarditis, and that's swelling or irritation of the sac around the heart, often caused by sharp pain. Causes can include immune system problems or responses, infection or injury to the chest, and usually you can hear like a rub when the tissues are rubbing to each other in the heart, but there's no rub sound during auscultation. Um, so the EKG, since it shows the elevation, we call 911 because this is at the clinic, so we can treat this one. So we call paramedics. Paramedics came, did another EKG showing SD elevation. So he was taken to the emergency department. Follow up within 1 week um, after treatment in the hospital or upon discharge from the hospital. So that's all for me. And I will write myself now. Thank you so much.